Subscribe to our YouTube channel and follow us on Facebook at Professional Health Forum for daily updates. In 1958, the world got its first glimpse of a new virus. It was found in a group of laboratory monkeys in Copenhagen, Denmark. A city known for its scientific advancements, this virus, initially called monkeypox, would later be renamed Mpox, reflecting its broader implications. The monkeys displayed a range of symptoms, including fever, skin eruptions, and respiratory problems, which alarmed the researchers. The discovery marked the beginning of our understanding of Mpox, a journey that would span decades. It raised important questions about the virus's origins, its transmission, and its potential to infect humans. The virus's discovery in a research facility highlighted the interconnectedness of human and animal health, a concept that would become increasingly important. It also emphasized the importance of laboratory surveillance and the need for constant vigilance. Researchers and scientists were put on alert, knowing that their work could have global implications. The race was on to learn more about this newly identified virus and its potential impact on both animal and human populations, a race against time and uncertainty. The Danish outbreak served as a stark reminder of the unpredictable nature of viruses and the need for ongoing research. It underscored the importance of preparedness and rapid response in the face of emerging infectious diseases, a lesson that remains relevant today. The world watched closely, eager to understand the implications of this new virus, and the story of Mpox was just beginning. 12 years after its initial discovery in monkeys, the first human case of Mpox was reported, marking a significant moment in medical history. This landmark event occurred in 1970 in the Democratic Republic of Congo, a nation in Central Africa known for its rich biodiversity and complex ecosystems. A young child presented with symptoms resembling smallpox, which included a distinctive rash and fever. This sparked concern and triggered an extensive investigation by health authorities and researchers.
The identification of Mpox in a human confirmed the virus's ability to cross the species barrier from animals to humans. This had significant implications for public health, as it indicated a new potential threat. It meant that Mpox could potentially spread from animals to humans, posing a risk to those in close contact with wildlife. This raised concerns about the possibility of human-to-human transmission, which could lead to outbreaks.
The case in the Democratic Republic of Congo placed Mpox on the map of human diseases, drawing global attention. It highlighted the vulnerability of populations living in close proximity to wildlife, where the risk of zoonotic diseases is higher. The discovery also emphasized the need for enhanced surveillance and control measures in regions where the virus was present to prevent future outbreaks and protect public health. Following the first human case, Mpox became established in several Central and West African countries. These regions, characterized by their tropical climates and diverse wildlife, became the primary areas where Mpox was considered endemic. This meant that the virus was consistently present in these areas, albeit at varying levels.
The virus found a niche in these environments, circulating among certain animal populations. Rodents, in particular, were identified as potential reservoirs for Mpox. These small mammals could carry the virus without showing symptoms, making them silent carriers.
The endemicity of Mpox in parts of Africa highlighted the complex interplay between humans, animals, and the environment in the emergence of infectious diseases. It underscored the need for a One Health approach. This approach recognizes the interconnectedness of human, animal, and environmental health. The world witnessed two significant Mpox outbreaks that provided valuable insights into the virus's behavior and transmission patterns, shedding light on how it spreads and affects different populations. In 1996 to 97, a large outbreak struck the Democratic Republic of Congo, affecting numerous communities and overwhelming local healthcare systems. This outbreak was linked to the consumption of bushmeat, a common practice in many rural areas. It highlighted the risks associated with the hunting and consumption of wild animals, emphasizing the need for better food safety practices.
In 2003, an outbreak occurred in the United States, catching many by surprise. This outbreak was traced back to imported rodents from Ghana, which were part of the exotic pet trade. These rodents had infected pet prairie dogs, which were popular pets at the time, which then transmitted the virus to humans, leading to several cases of Mpox. This outbreak emphasized the potential for international spread of Mpox through the pet trade, highlighting the need for stricter regulations.
These outbreaks served as stark reminders of the global reach of infectious diseases, showing that no country is immune, and the importance of international collaboration in disease surveillance and control, as working together can help prevent future outbreaks. They also underscored the crucial role of public health measures in preventing and mitigating outbreaks, from vaccination campaigns to community education. Public health on guard, surveillance and response. Public health surveillance plays a critical role in the early detection and control of infectious diseases like Mpox. Dr. Hiroshi, it involves the systematic collection, analysis and interpretation of health data to monitor disease trends, identify outbreaks and guide public health interventions. Effective surveillance systems rely on a network of healthcare providers, laboratories and public health agencies working together to share information and coordinate responses. Dr. Hiroshi. When cases of Mpox are identified, rapid response mechanisms are activated. These mechanisms include contact tracing, isolation of infected individuals, and if available, vaccination of close contacts. By breaking the chain of transmission, public health officials aim to contain outbreaks and prevent widespread transmission. Socioeconomic realities fueling the spread. Socioeconomic factors can significantly influence the spread and severity of Mpox outbreaks. Poverty, limited access to healthcare, and inadequate sanitation can create conditions that facilitate disease transmission. In many endemic areas, people may live in close proximity to animals, increasing the risk of zoonotic spillover. Furthermore, limited access to healthcare services can delay diagnosis and treatment, allowing the virus to spread unchecked. Addressing these socioeconomic disparities is crucial in effectively controlling Mpox and other infectious diseases. This requires a multi-sectoral approach involving not only health authorities but also other government sectors, non-governmental organizations and international partners. These initiatives encompass a wide range of activities including disease surveillance vaccination programs, health education campaigns, and infection control measures. John. By investing in strong public health systems, societies can build resilience against outbreaks and protect the health and well-being of their citizens. Public health measures are essential in preventing the spread of infectious diseases, reducing the burden on healthcare systems and saving lives. John, through collective action and a commitment to public health, we can create a safer and healthier world for all. The COVID-19 pandemic served as a stark reminder of the importance of investing in public health infrastructure and preparedness. The current outbreak, a timeline of emergence. The current Mpox outbreak began in early 2023 with cases initially reported in several African countries. The outbreak quickly raised concerns as it differed from previous outbreaks in its geographic scope and transmission patterns. Unlike previous outbreaks, which were primarily limited to Central and West Africa, the current outbreak has spread to multiple continents, including Europe, North America, and Australia. The virus's rapid spread through international travel highlighted the interconnectedness of the modern world and the challenges posed by emerging infectious diseases. As the outbreak evolves, health authorities around the world are closely monitoring its progression, implementing control measures, and working to understand the factors driving its spread. The outbreak has primarily affected urban areas, with cases concentrated in social networks and communities where close physical contact is common. Dr. Jean-Pierre, men who have sex with men have been disproportionately affected by the outbreak, highlighting the importance of targeted public health interventions and addressing health disparities. The virus's spread has raised concerns about stigmatization and discrimination against certain groups, emphasizing the need for accurate information and compassionate healthcare. Understanding who is most vulnerable to infection is crucial in tailoring public health interventions and protecting those at greatest risk. Dr. Hiroshi. While Mpox can infect anyone, certain groups may be more susceptible to infection or experience more severe outcomes. These groups include young children, pregnant women, and individuals with weakened immune systems. Dr. Hiroshi. By identifying and addressing the specific needs of vulnerable populations, healthcare providers can ensure equitable access to care and mitigate the impact of Mpox on individuals and communities. Remember to follow our Facebook page at Professional Health Forum.